My name is Dr. Maria D'Souza. I'm a geriatrician and the medical director of the JFS COMPASS program. The mission of the COMPASS program is to provide specialized medical care to older adults with dementia, and just as importantly, critical support for their caregivers, including education, counseling, and improved access to services, with the overarching goal that families affected by dementia in our community will receive the care and support they need to navigate the challenges brought on by this devastating disease.
When one begins the process of walking down that road with a loved one who has Alzheimer's and dementia, there's so many different factors that one is trying to contend with. There's the health of the loved one. There's all the practical considerations of how to ensure their care and safety. There's the constant presence of grief. And in those moments, it's really, really hard to find a way to get all the answers.
I really recognized in the course of providing care in traditional settings, caregivers are left to try to figure things out for themselves. And it was just apparent that there is such a huge need to really provide guidance and support for families.
And so when JFS literally fell into my lap, it felt like a gift and a miracle of miracles. Within a matter of days, Dr. D'Souza and her team literally swept in and wrapped us up in a level of attention and compassion and care that we had not experienced elsewhere.
COMPASS utilizes an interdisciplinary team approach to care. We draw on the expertise of professionals from different disciplines, from medicine to social work to nursing to occupational therapists and mental health counselors that are drawn into the fold of what we do, and we really try to create a cohesive care plan. Dementia is a family disease. It does not affect just the patient. It affects the entire family system. So the COMPASS program is unique in that we place equal focus on the medical care of the individual with dementia and the support of their caregiver. We are very intensively providing support that's very individualized and actively helping our families, our caregivers, to identify what their priorities are.
To have someone walk us through it, get the forms, make the connections, call in a hospice, call in the occupational therapist. I can't begin to tell you what a balm to my soul it was to have Dr. D'Souza and her team provide this for us. It is a level of care that is truly wraparound support. It is kind, it is compassionate, it is grounding, it is pragmatic. It is everything that you want in terms of support when you are navigating something as difficult and at times brutal as the loss of a loved one to Alzheimer's and dementia.
We honestly really strive to be completely open-minded and flexible to adapt to whatever needs a family has. And we strive to do this with a spirit of service and compassion. So we're definitely not cookie cutter in any way.